Hello, my name is Jessica Skopak. I'm a co-founder of the PACIO project and director of health policy and interoperability at Global Alliant. We are starting this Connectathon track with a vignette where we will demonstrate the capture, transfer, and visualization of patient-reported data gathered using the PROMIS-10, or Patient-Reported Outcomes Measurement Information System, Global Health short form. Demonstrations in this vignette will be completed by Global Alliant and MITRE. The PROMIS-10 is a brief 10-question standardized questionnaire developed by the National Institutes of Health, or NIH, to assess a person's overall physical, mental, and social health. Because it is brief yet comprehensive, the PROMIS-10 is commonly used in clinical settings, research, and population health studies to monitor well-being, track outcomes, and inform treatment decisions. It consists of items measuring 4 key aspects of global health, including physical health, including physical function, pain, and fatigue, mental health, including mood and emotional distress, social health, including satisfaction with social roles and activities, and overall quality of life and general health perceptions. The PROMIS-10 items are then scored to generate 2 summary scores, a global physical health score and a global mental health score. For the purposes of today's demonstration, we will be using a patient persona who may be familiar to those who have attended past PACIO Connectathon tracks. Betsy Smith-Johnson, a 74-year-old retired widow who lives in Detroit. She has a medical history that includes hypertension, hyperlipidemia, cataracts, osteoarthritis, ischemic heart disease, type 2 diabetes, and breast cancer, which is in remission. She also has been diagnosed with depression and bipolar I disorder. Betsy's patient characteristics have been meticulously curated to represent medical and social history that is realistic but entirely fictitious. Next slide, please. In this vignette, Betsy is completing a regular checkup appointment with her primary care provider. This slide illustrates at a high level the system's roles and users exchanging information. Next slide, please. And this slide dives a little deeper into the workflow and content of the data exchange over the following scenario. In July of 2025, after discharge to home from a stay in a skilled nursing facility where she was recovering from a fall, Betsy's PCP became concerned that she may require some additional support. Although Betsy received some services through a home health agency, Betsy's PCP thought that she and her family would benefit from some additional services to make sure she receives adequate care, while also supporting her personal priority of staying independent in her own home for as long as possible. Betsy's PCP suggested that she might be a good candidate for a government program, which would provide funding for the additional services she requires. Betsy's PCP asked her to complete a PROMIS-10 survey to assess her physical, mental, social, and overall health status, and to allow her PCP to track improvement or deterioration of her condition over time. That same day, on her own in the waiting room, Betsy completed and securely submitted the results of her PROMIS-10 survey to the government program on a tablet powered by a web-based Smart on FHIR application. Simultaneously, Betsy's results were transmitted to her PCP's EHR. Betsy's PCP received confirmation from the government program that Betsy is eligible and enrolled her in the program immediately, enabling her to begin receiving the services she needs without delay. Betsy has been receiving additional support for several months, completing the PROMIS-10 questionnaire periodically. PROMIS-10 scores are trending upward, showing signs of incremental improvement with the help of the additional supports. During today's follow-up visit with her PCP, Betsy completes and securely submits the results of her follow-up PROMIS-10 survey on a tablet powered by a web-based Smart on FHIR application. And now we'll turn over to the demoing the software. Bupati, would you please share your screen?
Yes, Jessica.
Thank you. So first, we're going to populate and submit the PROMIS-10 results as Betsy navigates to the link her PCP provided and enters her personal details to access the PROMIS-10 form. After completing and submitting the PROMIS-10 form, Betsy also can navigate back to this landing page and enter her credentials to view the responses she submitted at any time or to update her responses as circumstances change over time. And then we start the questionnaire. Using her login credentials, Betsy enters the app and the app queries her PCP's EHR system to receive some basic patient details that are pre-filled in the app such as her Medicare beneficiary identifier, to ensure that the PROMIS-10 responses are associated with the appropriate patient, Betsy. Betsy then enters the date she is completing the PROMIS-10 and responds to each of the 10 questions to gauge her physical, mental, social, and overall health status. Allowing Betsy to complete the form independently through the app reduces burden on the clinician, who no longer has to spend time asking each of the questions and capturing the responses manually during the visit. In this scenario, Betsy completes the PROMIS-10 in the waiting room of her PCP's office. But if she were in a hurry, or if the PCP wanted to assess her progress in between visits, she could take the link home with her and access the web-based app on her personal PC, tablet, or mobile phone at any time. Once Betsy responds to all the questions and clicks the Submit button, the results are sent in real time simultaneously to the government agency administering the program that provides funding for Betsy's in-home support services, the Questionnaire Response Receiving Server, and to her PCP's EHR system, represented by the existing PACIO sandbox. When the data are brought into the EHR, it is translated into an observation via the PACIO Personal Functioning and Engagement IG. For purposes of this demo, we have also included a window to display a preview of the questionnaire response JSON that is transmitted. This would not be visible to the patient, Betsy, in a production version of the Smart on FHIR app. Noting the significant improvement in Betsy's global mental health score, which is calculated at the bottom of the page after we hit submit, Betsy's PCP is able to share the results of Betsy's recent PROMIS-10 surveys easily and securely with her mental health care provider and her home health agency to promote more coordinated care. Additionally, they are able to see the trends of Betsy's progress over time. And with that, I will turn it over to the MITRE team to demonstrate how the pseudo EHR translates the PFE IG into observations and displays the trend data.
As mentioned, the questionnaire response has now been submitted, and Betsy's primary care physician might be interested in looking at how her self-reported mental and physical health is changing over time. So here what we're looking at is the PACIO pseudo EHR reference implementation. It's just a stand-in for an EHR system. The information should be listed here as a new questionnaire response. We see that a new one has been received on January 14th. That's today. And we can go ahead and look at her individual responses. And we're interested in seeing the trend information. So what we're actually going to do is we're going to convert Betsy's questionnaire response into a personal functioning and engagement IG data set. So it'll be a set of observations. So this would typically be an automated process, but here we're performing the conversion manually. So I click Convert to PFE Assessment. That's completed, and we have a set of observations. So now that it's been converted, we have observations for the most recent self-assessment plus some previous ones. So we can go ahead and look at the trend information under her observations. So we're going to look at observation trends. So as noted, PROMIS-10 does include some summary scores, and what we're interested in is viewing the PROMIS-10 T-scores. So let's go ahead and look at Betsy's mental health T-score over time. And we can see here how the primary care physician could review the general trend of how Betsy is reporting her own health. The color bands show PROMIS-10 cut points, and we can also, by hovering over individual items, we can see the more granular detail of how she's rating herself. We can see that her initial assessment winds up with a fair score, and that trends up over time into good, and in fact, very good. But perhaps of concern is how her self-reported scores has begun to trend back down again, and that's something that her primary care provider might follow up on. We can also look at the scores to her individual questions. So if we look at the observations list again, and we look for individual observations. As an example, her doctor might be interested in checking in specifically on how much pain she's experiencing at any given time. So if we search specifically for pain, we see there's 8 different survey results. And, starting at the bottom, we have our oldest. Her pain was initially reported as being quite high, reducing over time down to a reported pain of 1, but then the last 2 reports have trended up again. So, we can see information for individual questions as well. So in addition to being available to Betsy's immediate care team, these observations are, of course, able to be shared with others who might need this insight into her health. And one other thing that was noted when the form was being filled out is that questionnaire response can be submitted to multiple places. So if we disconnect from this particular system and look at the PQRS FHIR server, we should be able to see information for Betsy as well. And we can see that there's a list of questionnaire responses, and here we have one reported today as well from this demonstration. So that's it for this demo. Happy to hand it over to other folks for questions, comments, and additional info. Thanks very much.